experts are seeing significant improvements in Davao City in the fight against COVID-19, the OCTA research team noted the local government's aggressive response in lowering cases, but it says the city remains a high-risk area. Davao was placed under general community quarantine last week to curb the rise in infections. Mayor Sara Duterte says the city will follow should the health department recommend a stricter lockdown. Let's get an update from the city's COVID-19 focal person, Dr. Ashley Lopez. Dr. Lopez, good evening. Welcome to Newsnight. Can you tell us how are things now in Davao City?
I cannot say it's getting better because I still consider that the surge is going on. Although, if you would review our data for the past 2 weeks, meron pong difference. We have a decreasing number of cases.
Okay, so nagkaroon po ng decreasing number of cases because nag-revert po kayo sa GCQ. Ganun po ba yon?
Yung ano po kasi yung effect po ng GCQ is not expected in a couple of days. Usually, ang effect po niyan is ma-expect po natin by at least 2 weeks or more.
2 weeks or more pa. Okay. Are you hopeful that you will see a further decrease in cases?
We are hopeful po, Pia, kasi we have measures naman. We're maximizing all our possible measures that we could do in terms of in the aspects po of prevention, tracing, diagnosing or testing, and even sa reintegration po ng ating mga COVID cases.
What happened po ba, Dr. Lopez? Bakit po nagka-surge ng COVID-19 cases sa Davao?
We still consider po yung local transmission. Although initially, like any other cities naman, ang umpisa naman kasi talaga yung sa LSIs. But right now po, hindi naman gaanong kadami po yung LSIs namin. Now, yung local transmission, it's when, if you would notice po in our data, it's when we had already opened up economic activities during the time we de-escalated from ACQ, MECQ to MGCQ. So that time po, nag-start po ng MGCQ where people are going out already and we have already economic activities going on. Yun po talaga nagsimula ang surge. Actually, this is the second surge because we had the first surge sometime July to August po.
Oo. Pero hindi po ba, Dr. Lopez, kapag nag-reopen ng economic activities, people are very, very aware of that. As a matter of fact, kapag lumalabas ng tao, di ba, naka-face mask, face shield, may social distancing. So, kung nasusunod naman po yon doon sa Davao, dyan po sa Davao, bakit po ganyan pa rin nangyari? Is it because people were, for example, households were mixing with other households, walang kahit hindi economic activity, kahit hindi business, ano po yung what happened?
Yeah, despite po sa strict, in fact, Mayor Inday Sara Duterte issued several EOs already, lalo na in particular po, reiterating the observation of the minimum health standards, no? Yun nga po sabi ko kasi the time when the MGCQ was declared, tapos po na-lift po yung aming 24-hour liquor ban, doon po talaga nagsimula yung surge kasi partly blame po talaga yung sa mga activities po lalo na sa level po ng mga communities at ng mga households.
Okay, community households seeing each other, nagmi-mix na, parang they're seeing each other socially already, and that is a problem. So, are you going to be, will Mayor Sara, will the local government be issuing stricter guidelines, reminding people? Because the health department has said, hindi dapat nagmi-mix ang mga households, hindi po ba?
Yes po. Yes po, Ma'am Pia. In fact, we've been reiterating every now and then, lalo na po sa aspect po ng communications namin. We've been trying to intensify yung sa information dissemination, sa educating the people on the basic health protocols that we have. At saka po yung lifting po ng 24-hour liquor ban, ni-recall po yun. So we are now imposing the 24-hour liquor ban plus the curfew. We had set a curfew at 9 p.m. Para po yun po yung mga preventive measures na ginagawa po namin for the city.
Para mapilitan yung mga taong umuwi na maaga. But anyway, also, Dr. Lopez, si Mayor Sara naman, she has said that the city doesn't have any plan to do a granular lockdown ng mga of the 35 barangays. Ang sabi po niya, they will wait for yung recommendation ng DOH team, ng code team. Is there an update on that?
Yes, Pia. The code team arrived just last Monday. So I would like to clarify that there will be no granular lockdowns that will be imposed, lalo na po sa ating mga barangays.
Yes.
The updates right now is that we're trying to come up with a
Okay.
more effective operation center. We call it the Emergency Operation Center. With the help of Secretary Galvez and his Deputy si Colonel Mel Feliciano, we're coming up with an ETOC that would help us track down the system, develop po yung system namin. And at the same time po, on the field, we are trying to come up with the aggressive community testing, prioritizing po yung the 34 high-risk areas based po doon sa risk assessment po ng Department of Health.
Okay. And Dr. Lopez, my final question, kasi hanggang November 30, next Monday na po, 4 or 5 days away, no, ang GCQ dyan sa Davao City. Do you see lifting of this GCQ? Or because a while ago you said meron pa ring surge ng kaso, and we will only see the result of the GCQ in about 2 weeks' time.
Ang forecast po namin with all the things that we are doing right now is tatagal pa kasi ito ng mga around 1 or 1.5 months. So I don't think although the officially dapat si Mayor but I'm not expecting that GCQ will be lifted very soon.
Yeah, at lalo na siguro dahil Christmas na, no, December 1, mahirap na. People
Yes,
might forget to be, forget themselves na kapag Christmas. Siyempre, people want to celebrate well. Anyway,
Yes,
Dr. Ashley Lopez, dyan sa Davao City, maraming salamat po sa inyo, Doctor. Thank you very much for your time tonight.